This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Think of epinephrine as the body's ultimate panic button. It is the exact same chemical as adrenaline, the hormone your body pumps out when you are terrified, riding a roller coaster, or running away from a bear. In emergency medicine, pre-hospital clinicians and paramedics use it as a master key to manually take control of a patient's heart and lungs when everything is crashing. The cellular buttons, receptors. To understand how epinephrine works in different emergencies, you have to look at the three main buttons, called adrenergic receptors. It presses on your cells. Alpha 1, found on blood vessels. When pressed, it squeezes them tight, vasoconstriction, which hikes up blood pressure. Beta 1, found directly on the heart. When pressed, it forces the heart to beat faster and pump much harder. Beta 2, found in the lungs. When pressed, it completely relaxes and opens up the airways, bronchodilation. 1. Cardiac emergencies, bringing back the dead. When someone is in cardiac arrest, their heart has completely stopped beating. The main goal is to force blood back into the brain and the heart muscle itself. How it helps? Medics give a massive dose of epinephrine directly into the veins. The alpha 1 effect kicks in, slamming the body's non-essential blood vessels shut like clamping down on a garden hose. The result? This funnels whatever blood is left straight to the core, the brain and heart. The beta 1 effect also tries to shock the heart muscle back into a normal rhythm by increasing its electrical activity. 2. Respiratory emergencies, opening the airway. During a massive asthma attack or severe allergic reaction, anaphylaxis, the airways in the lungs squeeze shut and the patient's blood pressure can drop to dangerous levels. How it helps? The beta 2 effect is the superstar here. It acts like a giant reset switch for the lungs, forcing the tight, swollen airways to instantly relax so the patient can actually breathe. The bonus, the alpha 1 effect stops the dangerous drop in blood pressure by tightening up the blood vessels, keeping the patient from going into shock. Decoding the concentrations, the confusing part. If you look into a medic's kit, you will see epinephrine packaged in different strengths. Historically, these were written as confusing ratios, but today medicine is shifting to simple concentrations. Anaphylaxis epinephrine. Old ratio name, 1 to 1,000. New concentration name, 1 milligram per milliliter. What it's used for: severe asthma and anaphylaxis. Why it matters: it is highly concentrated, thick/strong. It's designed to be injected straight into a muscle like an EpiPen, so it absorbs slowly. Cardiac epinephrine. Old ratio name, 1 to 10,000. New concentration name, 1 milligram per 10 milliliters. What it's used for: cardiac arrest. Why it matters: it is watered down with normal saline. Because it goes straight into a vein, it needs to be diluted so it doesn't instantly destroy blood vessels or overwhelm the heart. What is push-dose epinephrine? Imagine a patient who isn't dead, so they don't need a massive cardiac arrest dose, but their blood pressure is dangerously low and dropping fast. If you give them a full cardiac dose, you might cause a stroke or a heart attack. If you try to mix a slow IV drip bag, it might take too long. Push-dose epinephrine is a clever hack used by emergency providers. 1. They take a tiny bit of the diluted cardiac epinephrine, 1 milliliter. 2. They mix it into a syringe with 9 milliliters of normal saline. 3. Now, they have an incredibly micro-diluted mixture. Every minute or two, the medic can push just 1 or 2 milliliters of this mixture into the IV. It gives the patient a tiny, controlled whisper of adrenaline, just enough to safely nudge their blood pressure back up to a safe level without blowing their heart out.